Dr. Allie has joined us. We are here on Carolina Women at Revive Rehab. It's so good to see you.
Good to see you.
You look fantastic. This is our space. I love this. This is the space where a lot of the magic happens. I thought it'd be interesting today. We were actually chatting about it before. When you first opened, what were sort of the goals and what direction did you think this business would take, and where have you gone? What's it morphed into?
Yeah, that's a great question. It's exciting because Jen and I opened this practice as a space for women to have a safe space to heal, right? And originally it was because of our own experiences after we had children.
And yours are 4 and 7.
4 and 7, and Jen's are 4 and 1.
Okay.
And so we both felt there was just such a lack of care for us and women in general after they had a baby. You kind of have a baby, 6 weeks later, okay, you're good to go. And a lot of our moms, they are not good to go. They're either having pain or abdominal separation or leakage and different things, and there is a specific timeline for healing after you have a baby, and it really involves a good months of therapy. Really, there's a guidance. So we wanted to provide that space. Hey, you've had a baby or you're pregnant, come in to us, let us help guide you through the pregnancy and afterwards so that you have the best outcome.
It's really interesting because there's so much literature and education around having the baby, the birth of the baby.
Yes.
But this is really a proactive sort of new direction.
Or what about, you prepare for having a baby and it's all about how to take care of the baby, but what about mom?
Right.
Right, because there's a lot, then you're so caught up afterwards in caring for your baby that it's important to take time for yourself. And so it's so interesting because that's how, again, a majority of our patients are pregnant or postpartum. However, what we've really seen is women that are going through perimenopause, menopause, hysterectomy, endometriosis, women that maybe not have had children but had painful bladder conditions like interstitial cystitis, which is basically a fancy word for saying painful bladder, a lot of urinary frequency, urgency. So there's all these other things that we're seeing now because patients, they hear about us or they found us on Google, or their doctors referring them, hey, why don't you give pelvic therapy a try? And then that ends up, being able to help their symptoms.
It's almost like you've opened up the conversation.
Yes, because let's face it, not everybody wants to talk about it. Right.
And now that you've opened up this dialogue and this conversation, everyone is feeling comfortable to say, okay, here's what's going on, what do I do?
And and we really, Jen and I pride ourselves in being providers that you can talk to, that will listen to you, that you're going to be heard, your symptoms are not in your head.
Correct.
And we really value that, being able to spend an hour with our patients and just really being able to give them the quality care that they need.
And you said that's what's been interesting is every single patient is a single patient. If you've seen one person with incontinence, you've seen one person, because everyone has different
Everyone's
things.
so different, and their reason for their symptoms, everyone's different. So you can never treat everybody the same, right? And so, what someone comes in, I've been doing Kegels and I'm not getting better. Well, it's because you weren't weak. So Kegels are not going to fix your problem.
Exactly.
So we can't tell you. We really want to mold your treatment to best fit your needs and what's causing your symptoms.
I mean, personal kind of testimonial. It's really been fun because every time we talk, I'll go back and talk to all my kids that are about your age and their friends.
Hey.
Oh my gosh. And they're like, the second you open up the dialogue with them and you really start talking, they're like, here's what I'm going through. What about this? What about this? When do I go? How often or when do you think people need to make an appointment? Do you like to see them when they're pregnant to kind of do
preferably.
Okay.
Preferably, we love to see our patients throughout pregnancy to help guide them along. And then we always tell our patients, you do not have to wait 6 weeks after you have the baby. We like to see our patients at 2 weeks afterwards. It doesn't mean we're going to be doing some hardcore strengthening or anything, but we can start doing some mobility, breathing, get you on the right track, make sure everything's going okay. So a lot of our moms come in even 2 to 3 weeks after they have their baby.
I tell you what, you are amazing. The 5 minutes goes so quickly. I always feel like we need another 20.
I know, I could talk about this forever.
Well, because it's fascinating, it's ubiquitous. We have all experienced something that I think you can help us with. So as always, Dr. Allie, it's a pleasure to see you.
Thank you.
Stay with us, more to come here on Carolina Women.